let's show on our little kitty friend Bob here. Right, let me get this out of the way. This here, yes. So Bob, you're such a good boy. Oof. Bob is an outside cat, and he usually doesn't like to be in carriers, do you? No, hi. All right, now he's purring. This has been covered in feel away. Hi, you want to come on out? Okay, so Bob is a fairly confident cat. He came right out of the carrier. He's not hiding in the back of the carrier. So when you have a kitty who comes out like this fairly confidently from the carrier, he's looking all around. We're going to do our little slow dump truck here, aren't we? Yes. That right away is going to tell you he wants his head up. He is not a cat who is going to like being covered over and wrapped up with a lot of towels. Okay, because he wants to move his body around. The cats who tend to like toweling, where toweling gives them security, are the cats who are laying down, they're hiding in the back of the carrier, they want to be like sort of collapsed in. Bob is not really like that, so I'm not even going to choose that method. He's our model. Yes, you were available. The neighbor said, I can lend you Bob. So I am going to use him to show some of these techniques. Now, so knowing that, it's not likely he's going to like a full body wrap, but say, you can see he wants to roll all over the place, and let's see if we need to do a jugular blood draw. We take off his little collar. Yes, we will put that back on, Bob. I don't want that to get lost. And I would get him holding your hands on either side of the shoulder to get him positioned like so. Then I'm going to come up around and we're just going to do our little shroud. And then, like I said, we only clip the towel. Okay? So now, I could hold him like so. I am not scruffing him. No, I'm not. And if I need to position him for, say, a jugular blood draw, I know. Now we could get your body rolled over. All right, you're right. He's gatoring a little bit. So I'm going to get first his hips between my elbows, yes, and then my 2 fingers underneath his jaw. And somebody, if my person were here, then they would hold the towel down to do the to do the jugular blood draw. Okay. Now let's say, for example, he needed a cephalic, an IV catheter put in the front leg, and a cephalic vein. And you were something else. And we wanted to, let's just imagine, he was hissing and upset and so on. So for Bob, let's get your body here. I want to just demonstrate how we would do that shroud. So to do that, remember I've got my hand towel. He's a bigger cat, so this should still work. I have my hand towel, and I'm going to come up and over his head like so. I know. And there's my clip. And I'm going to clip just the fabric. There you go. And now I can hold that sort of together. There you go. And now we've got like a shroud. So think of it like this as a quickie muzzle for the cat. Okay? And for Bob, we could let that down. You can see, when I take this down, he quits squirming so much because that's Bob. He likes his head out. Sorry, Bob, you're the model today. I'm going to have to use you a little bit. But it's not hugely stressful for him to be covered. And maybe, again, we have a cat who's a little bit reactive. They're going to be quick to possibly swat or maybe turn and bite. We may have handlers, and we may have people working with us who have immune-mediated disease. They may be pregnant. They may themselves have had some kind of injury. Safety is really important in our profession. Do not risk your own health. So making safety fun and less stressful for the animal that protects us is important. So this is one way. It's almost like a little bit for Bob. Okay, now if we're ready to put in that IV catheter, we could quickly flop it over his head. And now I'll get you positioned. My finger over here, you see that? My thumb is above his elbow joint. Hi, you. Yes. And then I can put this over, and it extends. See how my thumb is extending the leg? Okay. Yes. And that's how the IV can be put in. Okay. Now, as I said, Bob is he's very social. He really likes being touched. He likes being handled. So for a kitty like him, if I just made a choice to not have him, his head covered, taking your finger and having it along, like underneath the jaw here, always make sure your finger is touching a bony point on the body, and then you can direct the body and have control over the body, okay? So it's almost as if one thumb is behind the ear and here. I know. But honestly, with a kitty like Bob, it would be easier. He may even be an easier one that would allow him to lay on his side, because that's what he's choosing to do. And we can, I'm just like sort of cupping between the two jaw bones, and I'm massaging between his head. Now, yeah, it leaves my hand exposed. I would wear a pair of the Armor hand gloves to protect my hand. I'm 62 years old, if you didn't know that. I just had my birthday a little while ago. I'm becoming a little conscious of health risks if I took a risk on being bitten, because it is normal. The bacteria in the cat's mouth does create a bad infection. Okay, so here's a few tips, and your clients can do this at home as well. If they need to give subcutaneous fluids or B vitamin injection, they quickly put the towel down, you know, on their kitty care corner. Put this around. Just about everybody has these chip clips, and if you don't, have these made up for your clinic. They are wonderful as a marketing tool, and now the client could give fluids or hold their cat while somebody else gives an injection, and it's less stressful for the cat. Okay, thank you very much. I appreciate your time. I will have this uploaded to my YouTube channel, Dr. Sally J Foote. Please subscribe and hit the like buttons and all those good things. Share some of the information that I have on my website so we can also help our cats have really good care. Thanks a lot and have a great afternoon. Bye-bye.